My name is Michelle Lindeboom, Director of Social Services and Innovation for Franklin County Department of Job and Family Services.
And I am Vivian Turner, Chief Administrator for Community Support Services and Partnerships.
And at Job and Family Services, we envision a Franklin County where all residents are stable and have pathways to opportunities and success.
We want families to have a chance to thrive, not just survive.
Our agency offers a continuum of support from public assistance programs to meet core needs like food, housing, and healthcare,
to a wide array of contracted services to uplift and empower residents from cradle through career. Close to 1 in 3 Franklin County residents interact with Job and Family Services. That is an enormous impact and a tremendous responsibility.
Over the last year, we have continued to administer vital programs like Medicaid and the Supplemental Nutrition Assistance Program at record high numbers, consistently hitting and exceeding timely processing benchmarks set by our state and federal partners.
We've undertaken bold new initiatives to expand access to affordable, high-quality early learning, provide innovative employment and opportunities for young people, and create pipelines to in-demand jobs that pay a livable wage and place families on the path to the middle class.
Through our Family Stabilization Unit, we're taking a more holistic approach to address all the social determinants of health for some of our most vulnerable residents, and bringing Job and Family Services along with our sister Health and Human Services agencies to the people through our mobile unit. We're doing all this while continuing to navigate through a pandemic landscape that has created an array of new challenges, as well as some new opportunities for the more than 500 dedicated public servants that make up our agency.
The next year will bring challenges as well as opportunities of its own.
But with your continued support, we will meet those challenges and move closer to making that vision, your vision, of Franklin County a reality.
For every resident, every day.
All right. Good afternoon, Commissioners and County Administration. My name is Michelle Lindeboom, Director of Social Services and Innovation for Franklin County Department of Job and Family Services. I am joined today by Vivian Turner, our Chief Administrator for Community Support Services and Partnerships, as well as Walter Dillard, Deputy Director for Strategic Initiatives and the Family Stabilization Unit for Franklin County Department of Job and Family Services. In this testimony, my colleagues and I will touch on some of the challenges our agency has faced over the last year. We'll talk about strategies informed by behavioral economics and grounded in the social determinants of health, those environmental conditions that impact health and quality of life outcomes for residents, which we've employed to meet those challenges. We'll highlight innovative programs we've launched, as well as expanded our efforts to meet residents where they are through our Family Stabilization Unit and mobile offices. Our collaboration throughout the year with Office on Aging, Child Support Enforcement, and Justice Policy and Programs has served as a foundation for designing a truly human-centric business model, which is at the core of our One-Door Health and Human Services initiative. As we prepare for 2023, we're thinking differently about how we engage across our HHS ecosystems, and we're seeing our programs, including core assistance programs like Medicaid, through a new lens. We know the populations we serve on Medicaid tend to ping higher for chronic conditions like hypertension, high cholesterol, or diabetes. These are conditions that, if left untreated, can lead to costly, potentially life-threatening consequences. But what about invisible illnesses? If someone is struggling with depression or anxiety, or a more severe mental or behavioral health condition, it affects every aspect of their life. It's harder to find or keep a job. It can take a toll on your family, and the challenges can compound quickly. Too often, residents with severe mental health challenges and no coverage will end up in the hands of our largest mental health provider in our state, the jail and prison system. Medicaid can make all the difference. On the flip side, a state survey of Medicaid expansion enrollees found that 84% reported that Medicaid made it easier for them to work and keep a job. Or consider someone struggling with substance abuse disorder, such as an opioid use disorder. When left untreated, the consequences can be even more dire. In 2021, the Franklin County Coroner's Office reported 825 cases of overdose deaths, a nearly 50% increase from 2019. At this point, I think we all know a family whose lives have been changed forever because of a substance abuse disorder. Although the tragedy and suffering for that individual family cannot be overstated, it is truly a loss for our entire community. The opportunity cost is staggering. Medicaid can change that trajectory. That same survey found that nearly 1 in 10 Medicaid expansion enrollees who received a primary diagnosis for substance abuse disorder. The majority of those were diagnosed, were able to fill a prescription for medication-assisted treatment thanks to Medicaid. Beyond our Medicaid, our agency also uses Title 20 funds to provide access to residential and outpatient services for low-income residents through our partnerships with Mary Haven and House of Hope. Together, they provided comprehensive treatment, including cognitive behavioral therapy for our neighbors struggling with substance abuse disorder. We took the initiative to bring trusted mental health resources to our residents at no cost through our partnership with CredibleMind. Well over 12,000 residents have used this self-paced, confidential approach to learn more about their behavioral health through research-based self-assessments and connect with local providers through our partnership with Adam H. and their network. As we prepare to enter year 3 of the federal public health emergency, our Medicaid rolls remain at all-time highs, with nearly 450,000 Franklin County residents relying on our agency for access to health care. That's a 36% increase since before the pandemic, or to put it another way, that's enough people to fill up the horseshoe, not 1, not 2, 3, but 4 times. Yet we do anticipate the federal public health emergency will come to an end in 2023, perhaps as early as April. And when it does, we will have to undertake a process called unwinding. That will involve redetermining eligibility for each and every one of those 450,000 residents. While the timeline for conducting these redeterminations is more feasible than the 90-day limit our state legislature attempted to impose, it will nonetheless be an unprecedented undertaking for our staff. We need to factor in competing priorities around administering other benefit programs like SNAP. The Supplemental Nutrition Assistance Program, or SNAP, is the second largest of our core federal benefit programs, and one that can have a life-altering impact. Consider how any one of us feels when you're rushing into work and don't have time to eat something for breakfast. By the time mid-morning comes around, you might find yourself a bit short-tempered or struggling with focus. But now put yourself in the shoes of a first grader dealing with food insecurity who hasn't had a nourishing meal in days. She might fall asleep or struggle with attention. Maybe she'll act out. The easiest thing for an overworked and overwhelmed teacher to do is to punish her. They'll send her to the office, and after a couple more instances, she'll develop a reputation, and the next time it's suspension. Hunger and food insecurity, not knowing when or from where your next meal will come, can have lifelong developmental consequences. SNAP, as you can see, is more than just an anti-hunger program. SNAP helps stabilize homes and keeps families together. In fact, it is one of the most effective anti-poverty programs in the nation. In a given year, it keeps an upwards of 5 million children out of poverty and 2.1 million children out of deep poverty. As rising food costs continue to outpace wage growth, our community, and especially our youngest and most vulnerable residents, could be facing a food insecurity crisis. SNAP is the best tool we have to combat that. And thanks to the federal waivers, the more than 174,000 Franklin County residents who qualify for SNAP are receiving emergency allotments to bring them up to the maximum amount of benefits available based on their family size. But those emergency allotments are due to come to an end with the end of the federal public health emergency. According to the Ohio Job and Family Services Directors Association, most families would have to add close to $12,000 in income to make up the loss in SNAP benefits that they'll experience. It's going to be more drastic than anything our system has ever seen. and it's a challenge that could be facing us as soon as April. We got the first taste of how that might play out with our residents this summer when the state allowed a waiver in place since the start of the pandemic to expire and reinstituted interim reporting requirements for SNAP recipients with only a month's notice. About 20% of our SNAP caseload had never completed an interim report, and our state partners did not plan any outreach or education beyond a letter in the mail and a robocall. We took a different approach, one informed by behavioral economics, to bring the word out to our residents. We promoted the changes across our platforms. We created a toolkit for our community partners and even hosting a virtual lunch and learn to walk residents through the process. We will continue to monitor the situation around the federal public health emergency and look to our state partners to help families navigate the uncertainty when those emergency allotments do end. But we're also going to take proactive steps to educate and empower our residents and community partners so they're not blindsided, because we are still all in this together. While Medicaid and SNAP have seen massive increases in enrollment since the onset of the pandemic more than 2 years ago, it is the area of housing assistance where we've seen the most growth. We have used different federal funding streams, including emergency rental assistance and the American Rescue Plan Act, to greatly expand our prevention, retention, and contingency program to better meet the needs of housing insecure families and those facing the threat of eviction and homelessness. Since January, we've dispersed more than $7.46 million in rental assistance at an average payment of $2,816 to help keep more than 2,600 Franklin County families in their homes. That represents an overwhelming majority of all the emergency assistance payments we have made through our PRC program this year, golfing our next highest categories, which are mortgages and utilities. It's a more than 20% increase in the amount of rental assistance from what we provided in 2021. And that was a record year for us. We recognize that rental assistance alone is just a Band-Aid, and there's a huge shortage of affordable housing in our community. The challenges housing insecure families face are complex and interwoven with other factors within the social determinants of health. My colleagues and I will return to them throughout this testimony, and it is why we are requesting additional funding in 2023 for a family stabilization unit to face them head on. But before that, I want to take a moment to talk about staff. Think about the numbers you just heard. We are touching the lives of over 1/3 of our residents just through SNAP and Medicaid alone. But that work can be emotionally exhausting. Burnout is real. County JFS departments across the state, including ours, have experienced significant staffing challenges over the last 18 months. And we have the unwinding looming in 2023. That's why we are requesting $51.5 million in personnel services and fringe benefits to support our dedicated staff, including 16 new positions to support strategic initiatives, inclusive of our HHS agencies, as well as temporary staffing. We are also requesting $10.5 million for materials, supplies, services, and a capital building lease. This includes support for our proposed housing unit, as well as 2 new 38-foot mobile units to be in more neighborhoods and communities across the county. These resources and our robust benefits packages are critical to supporting our staff, but we're also committed to fostering a welcoming and inclusive environment. Over the next year, we'll be looking to collaborate with the Office of Diversity, Equity, and Inclusion to support the Racial Equity Council's recommendation of creating a DEI work group within our agency. This will create a safe space for open dialogue, because we know in workplaces where employees can see themselves in leadership in their colleagues and in the people they serve, and know that their voices are heard, have the benefit of being more productive. It's one way that we're incorporating behavioral economics and human-centric design in our staff retention model as well. I will now turn it over to my colleague, Vivian Turner.
Good afternoon, Commissioners and County Administration. This is Vivian Turner, Chief Administrator. Franklin County Department of Job and Family Services is currently the largest public funder of social service programs in our county, supporting more than 100 different youth, young adult, family stability, workforce development, and early childhood readiness programs. Our Rise Together blueprint to reduce poverty remains at the core of all of our funding decisions. That's why every time we bring a resolution to support one of our community partners up for your consideration, you hear me directly bring it back to the People's Plan, which itself is grounded in the social determinants of health. However, the impact of the pandemic and plague of gun violence are additional considerations we must account for as we reimagine our legacy youth investments. And the community's input, combined with your guidance and support from the American Rescue Plan, have allowed us to undertake bold new initiatives to help advance the vision of a county where all residents are stable and have pathways to opportunities and success. I'm trying to get my light back on, I apologize. So I'd like to take a moment to take a look closer at a few of our new initiatives this year. Franklin County Rise. The COVID-19 pandemic had made it clear how essential safe and high-quality early education is for our economy to function. In March of 2020, childcare programs in Franklin County were forced closed. Nearly one in six, remain closed 2 years later, and hundreds more are struggling to stay afloat. Many of those programs serve the more than 23,000 Franklin County children on publicly funded childcare. More than 2/3 of those children are Black and Brown children living in some of the lowest asset communities. They also trail their white and wealthy peers when it comes to kindergarten readiness. In March, Franklin County announced a historic $23 million investment over the next 2 years to strengthen our early learning system. Franklin County Rise takes a whole system approach, offering an array of grants and incentives to increase childcare affordability and quality. Franklin County Rise offers affordability scholarships of up to $10,000 for working families, just above the income threshold of 142% of the federal poverty level. To date, we have awarded 415 affordability scholarships to the tune of nearly $3.7 million from Franklin County's contribution. We're well on our way to exceeding our initial enrollment target of 500 scholarships by the 1-year anniversary of the launch. Franklin County Rise also offers 3 categories of incentives to help strengthen licensed child care centers as well as family home providers. We're offering incentives for programs that enter into new PFCC agreements, awards for providers who attain, maintain, or improve their Step Up to Quality star rating, and awards for enrolling children doing non-traditional hours. To date, we have awarded 758 incentives for over $1.2 million to support eligible child care providers across our county. The last pillar of RISE focuses on early learning educators, a workforce made up of predominantly women and people of color. These brain architects are among the lowest paid professionals, with average wages ranging from $11 to $12 an hour. That's far below the living wage, creating a housing cost burden for far too many. That's why Franklin County RISE also includes a dedicated emergency rental assistance fund in the amount of $500,000 to support early childhood educators. So far, we've dispersed nearly 40% of those funds to assist more than 100 educators remain in their homes. We recognize this aspect only treats one symptom of a much larger problem with our childcare system. We are committed in the long haul to working with you, commissioners, to make Franklin County a place where all families have access to affordable, high-quality childcare, and where every learning professional can live with dignity and support families of their own. Thanks to your vision, Franklin County is looking to lead by example as we explore transforming the old correctional facility adjoining the courthouse into a new, high-quality early learning center. When combining our ongoing initiatives to provide free step-up to quality training, funding for home visitation, and more, we're operating at a collaborative level on the human service value curve. Next, our summer youth work experience programs were one of our primary focuses in 2022 because we know these opportunities can be life-changing. With our ready-to-earn summer youth employment partners like the Columbus Urban League and Nationwide Children's Hospital, we were able to provide paid work experience with pay ranging from stipends of up to $1,500 to $15 an hour for over 650 high school age youth this summer. While it was short of our goal, it still eclipsed our totals from summer 21 by nearly 45%. Summer 22 was a tragic time for far too many youth and families in our county. And though some of the young people in our Ready to Earn program were no doubt touched by the tragedy over the summer months, we received no reports that they were arrested or found themselves involved with our criminal justice system. When you factor in the parents who were able to attend work over the summer with a peace of mind of knowing their children were safe, we're talking about a multi-generational impact. Between our Ready to Earn providers and partners in our year-round Achieve More and Prosper case management and employment program, we enrolled more than 1,200 young people in summer work activities. When factoring in our free full-day summer enrichment camps for upwards of 1,800 elementary and middle school students, our investment was well over $6.1 million to provide safe, structured activities for youth during non-school hours. These programs help to keep our young people safe from gun violence. They offset summer learning loss and fostered social-emotional growth, all while supporting parents and caregivers. The next step on our Cradle to Career continuum is workforce development. Franklin County was in the headlines in March when President Joe Biden touted local technology investments in his State of the Union speech. And you, commissioners, committed to developing the county's workforce to meet a growing demand for technology jobs, while placing equity at the forefront of your approach through a 2-year, $4.5 million investment to stand up the new Tech Women of Color Workforce Training Initiative. This innovative public-private partnership between Job and Family Services and the nationally recognized tech training nonprofit Perscholar will help to train and place 200 low-income women of color into good-paying jobs and place them on a path to the middle class. While the economy has rebounded over the past year, job growth, especially among women of color, has not kept pace with the overall rate. Employment disparities in the technology field predate the pandemic, but were even more stark today. Nationwide, Black women only make up 3% of the technology workforce, while Latinx women account for only 1%. The Tech Women of Color Initiative is a 15-week program that offers technical skills training, executive mentoring, financial coaching, and more. Participants graduate with industry-recognized credentials, ready to compete for high-paying jobs and in-demand technology jobs. In addition to paid internships and job placement services, graduates receive ongoing supportive services to help them navigate the benefit cliff, which occurs when a small increase in earnings leads to the loss of benefits like food assistance or publicly funded childcare. This is a targeted universalistic approach focusing on historically underrepresented and under-resourced populations to meet our local workforce needs. This inaugural class graduated less than 2 weeks ago, earning Cisco IT Essentials and Cisco networking certifications. Comparable courses can cost as much as $18,000 while the training, mentoring, and ongoing supportive services offered through Tech Women of Color are available at no cost to the participants. Next week, the graduates will begin their paid internships with employers like Nationwide Children's Hospital and even our agency. These 9 trailblazers, along with the 40 women already registered for our January class and the dozens more that will follow over the next 18 months, are evidence of Franklin County's commitment to investing in every resident every day. In Central Ohio, if Central Ohio is going to become the Silicon Heartland, we're not going to perpetuate the same workforce disparities we see in Silicon Valley. We're going to prove, as graduate Jasmine Robinson said, women can do anything, especially a mother of 5. Tech Women of Color is just one of the workforce initiatives, but this year is just one of our workforce initiatives. But this year we also launched a new public-private partnership with Service Relief for Hospitality Workers to recruit and train residents for employment opportunities at the new Cafe Overlook. Participants receive soft skills training and barrier removal services, along with a $750 stipend, and once employed, they receive livable wages. We also partner with the Office of Diversity, Equity, and Inclusion to help stand up the County Futures Initiative, while continuing to fund premier workforce training programs like Building and Driving Futures, which graduated their very first all-women's cohort in May of this year. Over the next year, we continue to look to expand programming to build more workforce pipelines for in-demand industries, while ensuring residents are able to earn a living wage, earn a living wage. As I mentioned earlier, we are the largest public funder of social service programs in Franklin County, and the programs and initiatives that I've highlighted this afternoon only scratch the surface. But we know we can do more to ingrain the principles of diversity, equity, and inclusion into our community contracting strategy. In addition to looking at the board makeup for our funded partners, we are also exploring ways to better measure the impact of our contracts. It's why we're working with our sister HHS agencies to align our contracting strategy through our One Door initiative. It is also why we've worked with our Office of Diversity, Equity, and Inclusion to set a goal of ensuring no less than 20% of our 2023 community initiatives focus on enhancing equity and equitable outcomes for historically marginalized populations and residents living in low asset neighborhoods. We hope to have your support to continue to invest in innovative programs to support and empower residents and families throughout our community. This is why we are requesting $71.8 million for social service contracts and programs. The largest portion of those funds include our federal temporary assistance for needy family funds, Title 20, emergency rental assistance, and American Rescue Plan Act dollars. If there are no questions, I would like to turn it over to Deputy Director Walter Dillard.
Good afternoon, Commissioners and County Administration. My name is Walter Dillard, and I have the pleasure of serving as the Deputy Director of the Family Stabilization Unit and Strategic Initiatives for Franklin County Department of Job and Family Services. The Family Stabilization Unit, or FSU, it was launched in the summer of 2020 during a time of civil unrest and overt inequities among the different demographics across the nation. One of the biggest systems we saw these inequities was in the juvenile justice system because, see, African Americans, we make up 13% of the population. However, we make up 34% of incarcerations in jail and then 45% in prison. So in direct alignment with the Rise Together Poverty Blueprint, FSU was charged with fostering family stability and promoting economic mobility by simplifying and streamlining the way residents interact with all of our health and human service agencies, not just Job and Family Services, but Office on Aging, Child Support, and Justice Policy and Program. While our scope initially focused on youth involved with the juvenile justice system, we quickly recognized that they and their families were pinging low across multiple social determinants of health. This includes, but is nowhere near limited to, low economic mobility, low education levels, living in disparate neighborhoods, and these non-traditional homes that are yearning for support. FSU's charge also comes with a unique perspective and responsibility to identify policies that further exacerbate the challenges we see in our disparate neighborhoods that are, by no coincidence, predominantly comprised of Black and Brown people. Our goal is to catalyze the systems level change that is needed to move along the human services value curve, right? From a regulative model focused on policy compliance and program eligibility, all the way up to the generative model where we co-create solutions for multidimensional families and socioeconomic challenges. So to date, we've connected with 1,474 residents with resources, primarily housing, education, and employment, but also mental health and services and many more. I am proud to report that thanks to this very intensive case management model we've implemented, there have been 0 families, none, that have gone homeless since getting assistance from FSU. Over 70% of the mothers enrolled in FSU have less than a high school diploma or GED. So after education attainment that we linked them with, we've created a referral pipeline to workforce programs that we started here in the county, such as Building Futures, Driving Futures, and even County Futures. And some of our mothers, I'm glad to report, as county administrator likes to call them, have become teammates here in Franklin County because they're working down here at our courthouse, thanks to these partnerships. And so currently we spent more than $110,000 to support families residing in these zip codes that are depicted on this map. The darker hues, they indicate areas of concentrated service dollars, right? You can directly overlay this concentrated map with the concentrated poverty heat maps that are featured in that Rise Together blueprint. Although we've accomplished so much in FSU thus far, our communities still deserve more from us and the bridge we've built in health and human services. So as we move forward using targeted practices, we plan to expand our development to the mobile units to connect more residents with resources. So since the launch of the mobile unit in May of 2022, we've reached over 2,500 residents at 44 different events, not just offering resources with our HHS agencies, but also transformational services such as staff recruitment events with human resources. This initiative allowed us to use a targeted universalistic approach to really break those barriers of transportation issues and those long wait times on the state shared services hotline, right? Although we have made a huge impact in 6 months, the demand for the mobile unit has skyrocketed and we are frequently requested for multiple events occurring at the same time. That's why in 2023, we'll be introducing 2 new mobile units and are requesting additional staffing capacity to support them. This expansion will significantly amplify our impact within the community and allow us to better meet the needs of residents where they are. It also supports one of those reoccurring themes that we see in the Rise Together blueprint, where residents stated the desire for more one-stop service centers located in these target neighborhoods. See, what we know is that poverty is spreading across Franklin County, and we don't want to cause distance or a lack of reliable transportation to be the barrier that's blocking these resources for our families. Additionally, our expansion will allow HHS agencies to begin publicizing and proactively marketing events with the mobile unit, permit public requests, bolster existing initiatives such as our on-site mobile office hours that we have at the courthouse on Tuesdays and Thursdays, how we've been doing Franklin County recruitment, or if there's another crisis such as when the power went out. And we get to pursue additional collaborations with community partners. It also allows HHS to conduct emergency response and direct outreach within our target neighborhoods. All of this aligns directly with that human-centric design principle at the heart of the HHS one-door model. Lastly, commissioners, we know that meeting residents in the communities that they are in is paramount for us to be successful. But some of our families we serve don't even have a community to call home. What we know is that 73% of our family shelter population are single Black mothers. 73. The dual crisis of the pandemic and housing affordability further magnify this problem. This year alone, there have been nearly 16,000 eviction filings in Franklin County. We have more people becoming homeless than people transitioning from homelessness to housing. Parents experiencing this often just need help completing school or obtaining employment. Children need counseling to cope with traumas of eviction or homelessness, along with intensive tutoring just to help them get to their grade level. And of course, the health and safety of the children must be a high concern. And it's because of this, that's why we're proposing a new strategic initiative that we're dubbing the Franklin County Housing Unit. It will be charged with assisting our most vulnerable families in obtaining transitional housing and use that tailored multi-generational intensive case management to help achieve complete stability. That means they're housing secure living and permanent housing. To achieve these goals, the housing unit will think holistically and act swiftly to respond when we encounter children, veterans, seniors, or justice involved residents that are experiencing these serious mental or behavioral health challenges. We're talking about wraparound services approach and a human-centric design model, all bolstered by a public-private partnership with Franklin County Lodging Association to help rapidly secure safe transitional housing. As always, commissioners and county administration, thank you for your attention and your continued support. And I want to turn it back over to Director Lindenboom for final remarks.
All right, thank you, Walter. Our footprint at Job and Family Services stretches across the entire county, with nearly 450,000 residents on Medicaid, more than 174,000 residents on SNAP, and 10,000 plus receiving Ohio Works First Cash Assistance, more than 23,000 children in publicly funded childcare, and over 400 more receiving scholarships through Franklin County RISE. The more than 1,200 young people who received a paid summer job through our Ready to Earn and our AMP program. The 37 plus kids in our free after school programs and summer camps. And of course, our first class of 9 graduates for our Tech Women of Color program. We know, however, that many of the programs, as well as the state and federal policies, and even some of our own, that govern those programs and our work were not designed to meet the new and changing needs that our families and residents face today. That's at the core of our One Door Health and Human Services initiative. We're working closer than ever with our sister HHS agencies, and over the next year, we'll be making greater strides in wrapping all the resources available around our families. We're grateful for the time you've given us to share this testimony with you today, and grateful for the opportunity to serve every resident every day. And we'll be happy to address any questions you may have.
Thank you so much for that overview. I have a couple of questions. One, dealing with the PHE, the public health emergency, and having 450,000 people on Medicaid currently. And we know that this increased during the pandemic, right? And so can you just talk to me a little bit, Director Lindenboom, on the number, like the percentage of increase or decrease from the pandemic, 2020, we'll just say 2020, and then 2021, and where are we with 2022, with whether we enroll more people on Medicaid, if it increased or decreased, and then how will the end of the PHE impact these numbers?
Right, so our rolls did go up tremendously just with the initial applications, and then during the public health emergency, we were not able to do the redeterminations. So no one came off our rolls of Medicaid unless it was a severe, someone passed away or, moved or whatever. So we didn't determine any of the eligibility. So although it increased, we didn't decrease it because sometimes people fall off after their year. So with that being said, it is going to be a tremendous overhaul. Some of our case managers have never even done redeterminations or renewals for Medicaid, and some of our residents have never done the renewal. So all the residents, all 450, will have to be done within a year's time, they're saying. And we just honestly heard the other day that those that are coming on through the FFM, we will only have 90 days to do something with them. Not quite sure with that. We just had a meeting, but there's some nuances with some people that came on during the open enrollment period.
Okay, and I know ODJFS was anticipating a number of people, I don't know if it's still 80,000 or something like that, that probably would end up terminating during the redeterminations. Is that still, are you still getting that same information from ODJFS? Okay.
Yes.
And so when it comes to the redeterminations and the time frame, and I think when we had our quick overview last week or a couple weeks ago, there is around 120 or so positions that you all have available. Do you need to staff up to do those redeterminations, or do you think you'll be good with the staff you currently have?
I think we will struggle because we have competing priorities as well. So with, the public health emergency ending, that'll also affect our SNAP residents. So it kind of goes hand in hand. And while we understand the SNAP residents will not have hearing rights, they always call their county department of, Job and Family Services. So it's going to be competing priorities. So we're going to have to shift some priorities that maybe we will not be able to complete, because that will be our priority, because we're going to be put on a timeline to, get this completed. And we're trying to hire as quickly as possible and train people perhaps a little differently for the Medicaid unwind piece. So we're being creative, going to hiring events, anyone, reaching out, trying to, fill our vacancies.
And I think our postings are ongoing. We keep them open, Commissioner, so that the jobs are available anytime that someone logs on and wants to apply. We actually, at our last event, past to present, this past Sunday, we identified, I think, about 5 people who we're hoping to bring onto our roles, but we are losing staff as quickly as we are gaining staff. So it's a constant turn.
Okay. And then my other question is summer youth. And I know we like to highlight, all the programs and things that are jumping off from JFS and the team, like it's a Herculean effort, but very proud of the work that you all are doing in the community. We see, how people are being able to really thrive with supportive services. And so I appreciate all the work that everyone is doing. But I know that there was an issue when it came to summer youth, and you highlighted it. And we haven't talked about it since the summer. I think there was, and you could correct me if I'm wrong, Vivian, but there was an age group that did not necessarily take advantage of the summer youth employment. And that's concerning, because we know that our youth need jobs. They supplement household income, and we need them to have meaningful activities during the summer to keep them, busy and then out of trouble. What age group was that? And then what are we going to do next year differently to try to capture that age group?
So, Commissioner, that was our 16 and up. And partially, we heard a couple of things. We certainly went back and spoke with all of our providers about what was different this year. We certainly saw an increase from 21, but we certainly didn't meet our goal and providing the opportunities to the numbers we thought. There were a couple of things. One is our paperwork can be just kind of extremely overwhelming. And so we're going to be looking at this year, what do we really need versus what we don't need, and trying to streamline that and lessen that burden on our parents and the young folks who want to work for us during the summer months. A lot of that is driven by our TANF eligibility, but we are going to look at ways in order to address that concern by the parents who expressed it. The second piece of it is that with the economy doing so well, a lot of our 16-plus-year-olds found other opportunities and jobs paying higher than $15 an hour. I think McDonald's was paying $17 this summer. Amazon was hiring, they were paying somewhere around 21. And so we were competing with the market with unsubsidized opportunities. And so many of our young people who may have signed up early found themselves in the position to take a higher paying job. Okay. And so that was a good thing. We see that as a kind of win-win. We want them to be able to grow through summer employment and move on to unsubsidized jobs. But that's another reason why we saw lower than expected enrollment.
Okay. I think the last question that I have when it comes to the Franklin County RISE and the Early Childhood Education Initiative and the number of families we're supporting right now. You said there's 415 scholarships. This launched in March. The other incentives didn't launch until later on. I think this is one of the most successful programs that we have this year outside of tech women of color. I mean, all the programs are successful, but I'm talking about like really helping people move up an economic mobility ladder, get back into the workforce. But we see when it comes to supporting, when we look at the Poverty Blueprint Plan and Franklin County Rise Early Childhood Initiative, we saw that childcare is a barrier for families, right? But we also see that as an employment issue for our teachers. And we are supporting, I think you said right now, 100 teachers for rent and utility assistance. And I know that application is closed. And some of the provider incentives, a number of them have been taken advantage of, but some haven't. And we're not even a full year in. But how else can we help the wage disparities that ends up being goal number 2 in our Poverty Blueprint Plan, and supporting our teachers and their wages, which are very low, in the early education space? What else could we be doing, I guess, going into 2023 to continue to address this need that's in the framework?
That is a huge lift, and we know that it's a major challenge. We can't continue to recruit new teachers to this industry and not pay livable wages. So we are working with various groups, including the state, to talk about, are there some pilots that we can undertake to address some of this? We're looking at shared services as a pilot. We'll be looking at possibly applying for that as a county next year as one of our alternative ways of dealing with some of these disparities. We're also looking to lead by example. We are standing up or looking at our new early childhood center that'll be downtown. We want to lead by example and show how we can effectively pay livable wages in this environment. And so we'll look to be a pilot, not just for the state of Ohio, but across the country in that effort. Along with lots of other initiatives, we certainly are working with our policy area and Lauren Rumble to make sure we educate the state legislator on all of the things related to early childhood education, the importance of step up quality rating, as well as the low wages of our early childhood educators, as we stated in the testimony, our brain architects. So looking forward to working with you on identifying even additional measures that we can undertake in order to address this disparity.
No, I appreciate it. I think we'll see in the next couple of months, and then we'll just continue to be remain in conversation as there's a lot of pieces of legislation that will impact you all. And so it's hard to talk about the budget as far as numbers and supporting staff and things that might be needed when we know that there's some changes that's getting ready to come. So you might get a pass on budget numbers right now. And we'll talk about it in Q1 or 2 as the operating budget moves. But I think you will be impacted, obviously, when the public health emergency ends and what support might be needed from the state. I also think as we target the benefits cliff, which Commissioner Boyce talks about all the time, and I am one of those parents who was in that space. If they increase the eligibility for early care and education, that definitely will change, I guess, how we're funding some of these initiatives right now. But also I saw from CCAO and Commissioner O'Grady, if he's still on here, I know he's over the government committee and looking at policy changes when it comes to step up to quality. We know reimbursement rates, but continuing to support those families that hit that benefits cliff will continue to be vital. So hopefully there can be some additional dollars that are available from the state that can come down to the county. So
yeah, absolutely.
So I won't give you the questions about budget right now in the dollars and cents perspective. All right. When will the buses come online, Walter?
It'll be mid to late summer of next year. So expect, I'll say July, August at the very latest.
How many families have you touched, or people or individuals through the mobile unit that's been here on Tuesdays and Thursdays?
Yes, so that's 2,500 residents so far. I can get the exact, so that's 2,500 from Tuesdays and Thursdays and the 44 community events that we've done. So I can get the exact number for you for Tuesdays and Thursdays.
Okay. All right. And maybe we could just circle back offline to talk about like targeting for when the new mobile units come online, outside of Tuesdays and Thursdays being down here, but what are we going to be doing? What's the calendar look like for residents? It is especially with all of the construction and things that's getting ready to take place down here, it's already hard to navigate this government center, but will be even more difficult as the construction with 71, as well as the municipal court. And so anytime that we can, since we're putting a significant investment in these mobile units, they need to be on the street as often as possible, providing services, just because we know it's going to be hard for people to, always be down here. So.
Absolutely. And what we've done so far is we have not concrete, but we have a clay schedule. We've mapped out a conversation with Primary One Health, Red Cross, and I need to have a conversation with the shelter boards, obviously, because that's going to be a big part of our population that we need to be servicing. How do we work in conjunction with the Rapid Resource Center as well? So there's a lot of things that we're going to have on the horizon, so that mobile unit can be out anywhere between 5 to 7 days a week. All three of them can be out anywhere between 5 to 7 days a week.
Okay, perfect. Thank you.
Absolutely.
Are there any other comments or questions from the commissioners or county administration? If not, that will conclude.
Sorry, no, we can circle offline. Home visiting is an issue, especially when it comes to maternal mortality and infant mortality. And I think this is a place where when I'm looking at, didn't hear it in your overview, but I would like to know what are we doing next year with county funds to support home visiting programs. For those who are on the call who may not know, when we look at the infant mortality numbers in Franklin County, the latest report, 93% of the infant deaths were from families who were eligible for home visiting, but was not taking advantage of that resource. And so we know that home visiting can save lives and is a great resource. I saw your hand, DCA Bivens, but did not hear that in your overview and would like to see a focus in that area.
DCA, do you want to go first? You can go ahead.
Just really quick, wanted to, and Chief, we have, as we're having these conversations regarding early childhood, what we understand is when we look across the landscape of all of our health and human service agencies, not just Job and Family Services, we have to be very inclusive of all the parents that are taking care of children in this age group. So the intention for next year, and I know Chief had a lot of things planned, we're going to try to galvanize, align all of those contractual partners so that they are being intentional regarding working with those families in that home visiting age, including our partners. So Chief, one of the things I said to Commissioner Crowley, I think a while ago, and I can't remember because all the conversations run together, we need to be inclusive of aging, because we do have grandparents that are taking care of kids in this age, as well as justice policy and program, as well as child support with their 105 children that they're touching. So again, just to try to galvanize all of our contractual partners so that they're not just honing in on one pot or one agency, but all of our health and human service agencies as we move forward in 2023. Chief?
Yes, so just to add to DCA Bivens' comments, we're also looking at how do we provide toolkits for families who are maybe not participating in our SPARK programming for early learning. When it comes to maternal health and outreach, we are partnering with Franklin County Public Health to kind of in that space to ensure that we have resources and services available for our families and our specifically targeting young women to make sure they have the care that they need, and linking them with the early learning kits and other supports that we'll provide to that population as well. So we see ourselves not just through the Health and Human Services lens, but also with some of our other county partners working to advance and bring a holistic approach to those populations that you mentioned.
Perfect. I see Director Brown has her hand raised. And I'll say the home visiting for Office on Aging too. I mean, so I talked about it with you all for infant mortality and maternal mortality because that report just came out not too long ago. But also, and I don't think Commissioner Boyce is on here, but he has been very adamant about, expanding services, especially for, our aging. And I know there's home visiting that takes place, or at least case management. But I think that that's another area where we could have more investment in streamline some of the contracts that we already have. Go ahead, Director Brown.
No, I just wanted to mention, as far as infant mortality, how important it is to engage fathers in the lives of their children, and having an engaged father, especially even during pregnancy, improves infant mortality rate. Our ability to provide the ABCs of safe sleep and those types of things. So just wanted, this is a whole, as DCA Bivens mentioned, this is a collaborative effort between all of our agencies, and I think we all have a piece in that work.
Thank you. Okay, Zach, you can go on.
Okay. Thanks, Commissioner. And then thank you to the JFS team for their presentation today. That will conclude today's hearing on JFS. We do have scheduled a bit of a break here, so we will be back, Commissioner, with your permission, at maybe a 10-minute break at 2:55, and we'll hear from the Office of Justice Policy and Programs.
Okay.